University of Cincinnati, AIS 4032, Module 5, not what the doctor ordered. In the first situation with the surgeon using a pen after scrubbing in, I would communicate directly with the surgeon and confidently state, "Excuse me, Dr. Surgeon, I noticed that you just scrubbed in, but after doing so, you signed your name with a pen that may not be sanitized. I really want to ensure the safety of our patient and that we maintain a sterile environment. I feel it would be a good idea for you to thoroughly wash your hands again." In the second situation regarding the Tyrant doctor, I would say, "Hi, Dr. Tyrant. Can you help me understand why you prescribed this medication for this patient today? I'm wanting to soak up as much information as I can. And last week, I remember we had a patient with a similar problem and a different medication was prescribed. Is there a difference in choosing this medication over the other?" And then if this doesn't give me the needed answer, then I would bring up whatever the situation was to my manager. In the third situation regarding an incompetent doctor, I feel the best idea would be to speak to my boss and give a recommendation on what to do. I would approach my boss and say, "Thank you for taking the time to meet with me about my concerns with Dr. Incompetent. I've worked with many doctors at this establishment, and the doctor I'm working with now doesn't seem to be nearly as competent as the other doctors I've worked with. I'm afraid the patients are not getting the care they deserve to receive. Do you have any recommendations on how I can approach this situation?" So some advantages of this approach are that I'm making an authority figure aware that there is a situation that needs attention. Talking to a supervisor also allows that my concerns will be documented. And a third advantage is that the supervisor can now observe the doctor to see if any actions need to be taken. A disadvantage of this approach would be if the supervisor doesn't do anything at all, then I feel like I would have two issues that need attention. One with Dr. Incompetent and two with the supervisor or the boss that doesn't take care of the situation. And then another disadvantage would be that it could possibly create some unnecessary tension between my boss and me. If my boss is close with the doctor, that could create some unnecessary tension, or if my boss doesn't take my concerns seriously. Thank you.